Right, let's get the show on the road. And in our first story, government says it is working to ensure current macroeconomic gains that the country is enjoying translates into direct benefits for the ordinary Ghanaian. A Deputy Minister of Information, Oppong Nkrumah, at a news conference on Tuesday indicated this is evident in steps being taken by government to deliver on promises. Joseph Opoku has more.
Addressing a media briefing in Parliament, Deputy Information Minister Oppong Nkrumah said the NPP administration is delivering on its promises.
If you read the first two paragraphs of the NPP manifesto, it concedes clearly that this is a change we've promised. But you must first develop strong fiscal and macro positions before you can use that to fund that change that you are looking for. And in the first 18 months, I think the record is that the fiscal and the macro has improved. Now the question is, how do you translate that improvement into full and complete delivery of your development agenda? And we're of the view that we are on course. We wish that everybody would be applauding by now that we have finished, but of course it's a 4-year agenda. We haven't finished with it, and we're hopeful that with where we are, we'll be able to fund and execute what remains of the agenda.
On the reviewed Ameripa deal currently before Parliament, he said government is committed to ensuring Ghana benefits hugely from the deal.
In spite of the numbers, we are committed to ensuring that the process of government works smoothly. We're examining the data. Government acting through Parliament has not finished with the work, and in the end, when we are done, we'll update the nation on what is in the best interest.
He also denied reported claims by aide to former President John Mahama, Joyce Bawa Mokhtari, that the ex-president's salary is in arrears.
As far as I know, he's been paid his ex gratia. He's been paid all arrears of his salary. He has been paid fully for this year, 2018. I think even as at July 18, his payments had gone through. So we do not have issues with that. I mean, nobody's going to stay in politics forever. So you want to treat everybody in a manner that is befitting, and it is not in the interest of the current administration to treat him in any untoward way.
Deputy Roads Minister Anthony Cabo said the $2 billion Ghana-Sino-Hydro deal approved by Parliament last week will help deal with the galamsey problem in the country.
I'm sure many of us will admit that, for instance, we have a galamsey menace that is hurting our country. Who are those largely in this galamsey menace? It's the Chinese. So now if we have a smart and intelligent way to address the Chinese and have a barter system where their populace do not have to populate our country to mine our gold, but rather we say, look, we are going to give you processed gold whilst you help us with financing for all these massive projects that we are talking about within the Sino-Hydro 2 billion facility. You should see the type of projects that we are embarking on.
On to other stories now. Threats by members of the University Teachers Association of Ghana, UTAG, and the Ghana Medical Association to embark on industrial action has got the National Labour Commission working overtime to avert it. UTAG says it will start a strike today as the deadline given government to pay its members 2017-2018 book and research allowances elapsed on Tuesday. The Ghana Medical Association, on the other hand, has also given government until August the 5th to respond to their demands of improved conditions of service, failing which its members partially withdraw their services. Chairperson of the National Labour Commission, Andrew Kwabena Samoa, tells JoyNews the Commission is adopting a fast-track approach to settle the impasse between government and the agitating labour unions.
Medical Association, we got to know about it, I think, yesterday, and we have immediately contacted the Minister of Health and the other relevant authorities, and the minister is trying to have a meeting with the staff. Whatever happens, we will arrange to meet them as soon as we hear from them, which I think will be tomorrow, latest Friday, and we'll try to find a resolution to the issues. With UTAG, we just got to know this morning. We have already informed the minister, who has assured us that he's making efforts to contact them, and we are going to make sure that we try to find a resolution to this matter also. As of now, I cannot say very much because we are waiting to hear from the minister. We are in contact with UTAG, so by the end of the day, we will have an idea of where we are. We appreciate the issues and we are doing our very best to resolve it. We know that they have a case, but we feel that we find a mutual resolution to the matter. So we implore them to hold on, to talk to us, to let us find a resolution rather than this going on strike as of now. We are very, very worried about it. We are very concerned about it. And as I say, we are working around the clock to ensure that these matters are resolved at the earliest possible moment, ensure that this matter does not escalate.
Andrew Asamoah there and his team working overtime to ensure the avoidance of this impasse, which could lead to very costly strike action. Now let's turn our attention to the education sector, and the Ghana National Education Campaign Coalition wants government to put in place emergency measures to decongest classrooms. Now the said plan should be implemented within 1 year. Following the implementation of the free SHS program in September 2017, there have been reports of congestion in some schools, with students sleeping in the open or in makeshift structures. Now, as a solution to the congestion, the coalition is suggesting that government reduces the number of boarders and increase the number of day students admitted. There's more in this report.
The spokesperson for Ghana National Education Campaign Coalition, Bright Appear, said the high class size of up to 160 students is negatively affecting academic work. The coalition has recommended that government convert 10% of secondary schools into model schools, where those willing to access secondary education as boarders can pay in full and access accordingly. The coalition also recommended that parents should be allowed to play a role in the program.
We have put a lot of pressure on boarding schools, which, if you look at the number that we have, the system is absorbing about 70% into a boarding school and a 30% to day schools. The reverse should be the case, that government should try as much as possible to make 70% day student to have access to community-based schools, and then 30% boarding. The amount government is giving for feeding fee for day schools should rather be spent in other areas, especially in the area of infrastructure development for day schools, so that parents will take out the responsibility of providing feeding for their wards, so that whatever amount that is there should go into the infrastructure development.
On the issue of double track system, the coalition believes the introduction of the system to address challenges of the free SHS has been riddled with inconsistencies and political innuendos. The coalition says politicization of the system threatens its success.
Education is human right. It's a fundamental human right of people. So any matter that relates to the discussion on how to move education forward should be devoid of politics. We should look at it and discuss the substantive issues. So when government is putting out an announcement on issues that would enhance education, I think that from our point of view, we should galvanize every person, everybody, and we have to bring everybody on board to ensure that we implement the program in a way that would address the fundamental needs of people.
The Ghana National Education Campaign Coalition is calling on government to engage stakeholders when the policy document of the proposed double-track system is ready. Patricia Gasu's report for JoyNews.
And of course, that was Bright Appear. On to the Ashanti region now, where medical superintendents of government hospitals in the region are calling on government to consider extending the period for the implementation of the new tariffs for drugs in all health facilities. Director of Pharmaceutical Services at the Komfo Anokye Teaching Hospital, Alhaji Kofi Baye, says stock of drugs in their facilities were procured with the old tariffs, and no facility has taken delivery of any new stock for the new tariffs. He disclosed this on the sidelines of a 3-day annual retreat for medical superintendents in government hospitals at Ejisu.
The new tariffs.
Mr. Bayer says currently the various suppliers have refused to supply all health facilities with the new rate due to the unstable nature of the market. They want authorities to exercise patience to avoid any challenge to the health facilities.
The government is claiming that they are waived VAT for medicines. In view of that, manufacturers and importers promise that they will reduce prices of medicine by 30%. But I believe that what they should have done is to do a market survey to find out if that has actually been done. Now, we did our last procurement, and I can tell you, almost all the syrups were above the new tariffs. And almost all the products that we bought, we didn't have the 30% markup that they are talking about. And the tariffs also came at the time that we have old stock. Now the question is, what do we do with the old stock that are above the new tariffs?
The 3-day retreat brought together 25 medical superintendents from government health facilities in the region, as well as other stakeholders in the health sector, to discuss issues related to quality health care delivery in the country. As part of the retreat, the medical superintendents embarked on health outreaches at Ejoso, Dwabe and Onye government hospitals. They manage various health conditions as well as conduct 50 major surgical operations. Dr. Fred Adomako-Boateng is Deputy Director of Clinical Care at Ashanti Region.
We can minimize as much as possible from our facility. So he took us through some of the ways that we can really handle that. And one crucial one is the tariffs manuals that we have, the operation manuals that we have, how the tariffs are arrived at, how we make diagnosis, and make sure that we stick to what National Health Insurance requires from us. And then we've been able to chart the way forward. One of them being getting vetting committees within our facilities, and the vetting committees actually, the prescribers to be part and parcel of these vetting committees.
Reporting for JoyNews, Kwesi Deborah.
Right then, before we go, in the Upper West region, a population officer, Abu Salifu, says family planning services and commodities should be made generally accessible, available, of good quality, and acceptable to all women of reproductive ages. Mr. Salifu says government needs to incorporate family planning policies and service delivery into its development agenda. Mr. Abu made the statement at the Post-World Population Day celebration at Bihe in the Wa municipality. Here is Rafiq Salam's report.
According to the Ghana Statistical Service, the northern and upper regions are the poorest in the country and also have the highest average number of births to a woman over her reproductive years. In addition, northern, upper east and west regions have a total fertility rate of 6.6, 4.9 and 5.2 fertility rate respectively. This means the women in these regions will have 5 and 7 children during their reproductive years. It is based on the aforementioned figures and other related matters that government carved out from the global theme of the celebration of World Population Day. Family planning is a human right and imperative to sustainable development. Bihe, in the Wa municipality of the Upper West region, was the venue for this year's celebration of the Post-World Population Day. The community has close to 1,400 residents with inadequate social amenities. Upper West Regional Population Officer Abu Salifu stated that the population of the Upper West region, according to 2010 Population and Housing Census, revealed a 21% increase in the population, who does not augur well.
It is therefore important that we encourage families, couples, and individuals to have the number of children their finances can comfortably cater for through the use of modern contraceptives. Deliveries, we say, should not be too soon, it should not be too frequent, it should not be too many, and giving birth should not be very close.
Mr. Abu noted that for family planning to be seen as a human right, family planning services and communities should be made generally accessible, available, and of good quality, and acceptable to all women of reproductive ages.
It is our hope that this year's World Population Day celebration would provide a platform for renewed commitment from the government and all stakeholders to provide resources to support the full implementation of national programs, and also think of accepting family planning in the National Health Insurance Scheme.
In a speech read on his behalf, the Wa Municipal Chief Executive, Tai Risaku Mumin, urged the people to embrace the concept of family planning.
When it's a couple or individuals are encouraged to have a number of children, their finances can comfortably cater for, the burden on limited national resources will reduce, thereby giving government the ability to provide better socio-economic amenities to improve our standard of living.
Reporting for JoyNews, Rafik Salam, BA.
Indeed, that is the news for this morning. Now, later today, remember this word, victory. That is the title of the debut track released by the Multimedia Choir. Now, the song features Calvis Hammond and Omari Kisi. It was birthed in a difficult period to uplift the broken-hearted and also to thank God for His grace. The song was composed and arranged by Groovy Eye, George Adu Jr. Stay tuned for that and so much more later on the AM Show.